The Ministry of Health and Wellness is investigating reports of patient neglect at the Northern Regional Hospital. One family alleges that a loved one was taken to the hospital for treatment after she began suffering from heart pain. The family member further asserts that the healthcare providers at the facility refused to help. Other patients were reportedly pleading with the hospital staff to assist the woman. That did not work, and the woman decided to bring public attention to the incident. Here is the video that she made public.
Muy buenas noches, señores. Como ustedes pueden ver, estamos en el hospital de Orange Rock. La señora se está muriendo de dolor, de corazón. La acaban de operar y no la quieren atender. ¿Qué ustedes piensan de esto? Todos los pacientes que estamos aquí estamos pidiendo que ayuden a la señora y simplemente dicen que no la van a atender porque tienen otros pacientes el cual no están haciendo nada. Señores, ¿qué ustedes piensan de esto? La señora se está muriendo de dolor, de corazón.
We spoke with Dr. Jorge Polanco, the Director of Hospital Services, who was at the Northern Regional Hospital today investigating the complaint. Dr. Polanco met with the hospital staff that was on duty at the time. Here is what he told us.
She had a surgery during that day, which was considered a minor surgery at the back. Minor in the sense that it was even done with local anesthesia. So the surgery was completed and she went home. However, around 8 o'clock, she returned with pain. In reality, it was not an issue of the heart. It was an issue of the wound that was done, of the surgery that was done earlier before, and she was having pain. However, the issue of she not being attended to really is not the way it was depicted in the video. That person was seen at 8:20 during the night before the video was taken. She was seen by a nurse, and then when the nurse observed the overall clinical condition, she was told to wait a few minutes and then they would return to her. Because at the same time, the doctors working were dealing with 2 other emergencies in the trauma room, and the nurses were there also busy. At 8:24, which was 4 minutes afterwards, the nurse came out and called in the patient for her to be evaluated, not knowing that the video had already been taken. Even the doctors nor the nurses knew that video had been taken until afterwards, many minutes afterwards. So the patient was seen, as I'm telling you, at 8:24, and I'm claiming this because that time when it was recorded in our, what we call our health information system, automatically documents the time where the entry was made.
Right. According to Dr. Polanco, the patient was seen by a doctor and given 2 injections to alleviate her symptoms. He further stated that the doctor who performed the surgery on her requested an x-ray to be done the following day. He says that the x-ray returned normal.
People would post concerns in regards to long waiting times at the hospital. Correct. We went in depth as to the long waiting times, and there is some degree of truth in many cases. However, I must say that when people would wait long, it's not because they would not have been assessed. Some of those patients who claim they have been waiting long is maybe they would be at the outpatient section, perhaps waited 1 hour, 2 hours. They were then seen by a medical officer who would say, you know what, you need to go to the emergency room. At that point, they would go to the emergency room. And they would be seen, but they would be adding all those hours that they would have waited elsewhere. And vice versa, it happens when the outpatient setting is overflowing with patients. Some would, on their own, go to the accident and emergency room. But if the issue is not an emergency, they would be told, just wait a little minute while we finish with other emergency cases. So these are situations that form the context of these complaints in regards to waiting times. Also, we looked into the communication approach. We emphasize to our staff that everybody should be patient-centered. Everything should be revolving around the patient. So everything that is done, everything that is said, it should have some impact on the patient. And at the same time, the patient should be aware as to why he or she is being told to wait, as to why he or she is given a prescription or whatever. And many times the communication skills are not the best. So this is something that we are cognizant, and efforts have been done, especially here at the Northern Regional Hospital also, where exposures to trainings on communication skills has been given.
Reporting for News 5, I am Paul Lopez.